Dr. Ashley Bloomfield is spokesperson for the DHBs. I asked him what he thinks the sticking point is.
Look, I think, John, there are two things in particular that the nurses are saying. First of all, they don't feel that the DHB offer makes them feel valued. And I think the second thing, and we've seen this coming through the social media commentary and the general concern from the nurses, is they don't necessarily feel that their concerns are being heard, that the pressure that they're under is really being responded to. And I think those are two things I've really taken from the nurses' rejection of this latest offer.
Right, and what do you say to those two things?
Well, what I say is that in the first instance, you know, they greatly respect nurses. They're essential members of the health team, and I've spent my career in health. I trained originally in medicine, so I've worked with nurses all my career. And, you know, they're really fantastic and essential members of the team. And we don't want them thinking they've got to take industrial action to be heard. So whilst as the district health boards, you know, we're disappointed our latest offer's been rejected, what we're keen to do is find a way through it. And we've already reached out to the NZNO to organise an urgent meeting to, you know, just work out what is the way forward.
Is there more money available?
Well, I think that is certainly one of the things we've heard from the nurses. They don't think that the offer contains enough money, and what I can say is after the first offer was rejected by the nurses, the DHBs got around the table with the nurses organisation, and now they had gone out to their members and asked them what it is they would like to see in a revised offer, and we worked really hard to come up with something that we thought would meet their expectations, and that the offer that's just been rejected was, you know, really right at the limits of our affordability and our current funding. But we'll need to see, you know, what else it's going to take in terms of the pay offer to really get it across the line.
And that's a key phrase, isn't it? Your affordability at your current funding. In other words, you need to wait on the budget, don't you, to see what your funding is. I mean, I'm looking at DHB deficits blooming. They are getting bigger and bigger each month. You guys have absolutely no money. I've just been reading a Treasury report that says there have been all sorts of excessive efficiencies around CapEx, and there are a whole lot of tired old buildings that need some money spent on them. Even if you wanted to give money to the nurses, you haven't got it to give.
Look, there's no doubt, John, there is a lot of pressure in the system, and the funding is one of those pressures. I think one of the things the nurses are talking about, though, is the pressure they're feeling at the front line. And so whilst money is part of the solution, there's also that real pressure they're feeling from the demand, you know, the people coming in through the door, and it's the nurses who really feel the brunt of that. You know, they are the front line, they're the ones caring for these people. So part of it is about the money, and yep, we need to live within our means, but also they really want to know the DHBs are taking that seriously, and I can tell you from the conversations I've had with my chief executive colleagues, we're aware of what those pressures are, and we're really keen to find out what else we need to do.
But they're resource pressures too, aren't they? The messages that we keep hearing is that there simply aren't enough nurses, that they feel underpaid and overworked.
Yeah, that's the message we're seeing too. There's no doubt that in many parts of our organisations, that many frontline staff, you know, in the emergency departments and community nursing and our acute wards, they really do feel the pressure. And as the population increases come along, and there are more people accessing services, and of course with our ageing population and more complex chronic conditions, the nature of the work is more acute and it's more complex, and so the nurses do feel that. We have, you know, it's not to say there aren't more nurses in our organisations, in our DHBs. Year on year, we're employing more nurses. The question is, you know, is that enough, and how are we deploying them across the organisation?
And answer that question for me. Is it enough? Because the nurses are telling us, and actually, when the DHBs aren't speaking on the record, senior people in the DHBs are telling us it's not enough.
Well, I think it's variable, John, and it's variable both across DHBs and within DHBs. And I just do want to point to the Care Capacity Demand Management Program, which is a key part of the settlement and the offer, and the commitment of all DHBs to settling that. And what that program does really is look at very carefully, ward by ward, what is the number and what is the mix of nursing staff that are there, and is there a match between actually what the demand is and what the number is. So that'll give us a really good idea and a really good platform to work through and find out, have we got enough nurses, and have we got the right skill mix amongst the nurses that are there.
And if the answer to the question, have we got enough nurses, is no, then you need more money, don't you?
Well, what we need then is more nurses. And of course, what DHBs have to do is work out how they can fund that from within their budgets. And look, we always have to make trade-offs. There's always, even if the government put more money in to health, we would still have to make trade-offs. There's always more we can do. But what the DHBs have committed to is implementing that CCDM program and then implementing the findings. And so if it says we need more nurses, we have to work out how we can employ and get those nurses on the ground.
Dr. Ashley Bloomfield, who is spokesperson for the DHBs in this dispute, for want of a better word.